In Kano State, giving birth is still a matter of life and death. Every statistic hides a face. Every number tells a story of a mother, a newborn, a family hoping for survival. Against this backdrop, the Resource Center for Human Rights and Civic Education, CHRICED, convened a validation workshop to review findings from its maternal, newborn, and child health readiness assessment of primary healthcare facilities across Kano State. Held at Bon Hotel Kano, the workshop brought together senior health officials, development partners, civil society actors, community representatives, and CHRICED staff. CHRICED's research consultant, Mrs. Loveth Anthony Iotier, presented key findings from the assessment, sparking in-depth discussions aimed at ensuring the report reflects realities on the ground. In his welcome address, CHRICED's Executive Director, Comrade Dr. Ibrahim M. Zikirulahi, highlighted the urgency of the crisis, noting that Nigeria accounts for nearly 20% of global maternal and child deaths, with Kano State bearing a disproportionate burden. He called for stronger health systems, improved access to quality care, and sustained support for frontline health workers.
Maternal and child health is not only a public health concern, it is a moral imperative and a global development priority. We acknowledge the efforts of the Kano State government in addressing these challenges. As a civil society organization, CHRICED believes that one of the most meaningful ways to support government is by empowering citizens with accurate information, highlighting what is working, and constructively identify areas that require urgent attention. As we examine the preliminary findings today, it is important to reflect deeply on the state of MSC service delivery in Kano. Nigeria currently accounts for nearly 20% of global maternal and child deaths, with Kano State bearing a disproportionate share of this burden. Reversing this trend requires bold, coordinated, and sustained action. Improving access to quality health care for women and children, strengthening emergency transport system, upgrading primary health care facilities, and investing in the training and welfare of frontline health workers. As we proceed, I appeal to all participants to engage rigorously in the detailed report. Your perspectives, critics, and recommendations are essential to enriching the final document and ensuring it becomes a valuable resource for government, development partners, researchers, and more stakeholders committed to strengthening Kano State's primary healthcare system. I am confident that your contributions today will help shape a more responsive, equitable, and effective MNCH framework for our dear state.
Dr. Zikirulahi also acknowledged the role of the Kano State government and development partners, stressing that evidence-based planning and active citizen engagement are key to saving lives. He recalled that since 2016, CHRICED has worked closely with government institutions and communities to promote practical, people-centered solutions to maternal and child health challenges.
Distinguished ladies and gentlemen, the Honorable Commissioner, since 2016, CHRICED has worked alongside government institutions, community actors, and development partners to advance practical solutions for improving MNCH outcomes in Kano State. Our advocacy has consistently focused on ensuring that every woman and child, regardless of socioeconomic status, can access quality, life-saving healthcare services. We also acknowledge the invaluable contributions of foreign, Commonwealth and Development Office and other international partners whose support continues to strengthen the MNCH landscape in Kano State.
The Kano State Ministry of Health assured stakeholders that the findings from the assessment will help guide policies to strengthen health facilities and improve service delivery across the state.
This facility assessment that was just conducted in Kano, we see as a very critical step in strengthening the health sector. Because it's only when you know what you have and you know what gap exists, then you'll be able to plan meaningfully. Otherwise, you just you waste your resources doing things that are not necessary or doing the right thing at the wrong time. But now that we have the assessment, will give us the light and direction to go.
Community leaders also stressed the need to mobilize families and promote trust in health facilities, protect the lives of women and children through collective responsibility. As the conversations continue and policies take shape, one message remains clear. The insights from this assessment could help turn data into action, ensuring that every mother and every child in Kano has a better chance to live.